We're going to begin our show today by talking about healthy beginnings, how the circumstances of a child's first days, months, or years can have an impact on his or her life. We've discussed one part of that, early childhood education, often on The Sound of Ideas as part of our first 2,000 Days project. But today we're going to look more broadly at the well-being of youngsters, at their health, from conception to their toddler years. Healthy Beginnings is the theme of the next 10 weeks of coverage from our award-winning Be Well Health team here at IdeaStream. And from Be Well, we have this morning Sarah Jane Tribble, the health reporter. Very good to have you with us.
Good morning.
And Kay Colby, managing producer of health coverage here at IdeaStream. Thank you for being here.
Well, good morning.
Good morning. So, Kay, what do we mean when we say healthy beginnings? What kinds of stories are you guys looking into?
Well, this is really cool because we're actually looking at the different environments. We're kind of tracing the path of a child from when it's a developing fetus in the womb, into the delivery room, into the home settings. And so one of the stories I'm pretty excited about that's coming up when we look at things in the home setting has to do with something called toxic stress. And this really stems from a new area of brain research. And what we used to think like babies and toddlers would kind of like lie around, the babies would sleep and the toddlers would play and not really pay attention to what's going on around them in the home. That couldn't be further from the truth when it comes to brain development. So what happens is toxic stress is like a chronic stress situation. It could be abuse, it could be neglect, maybe it's domestic violence in the home where there's a lot of screaming, things that really promote instability. Maybe it could be the stress of poverty. The family doesn't have stable housing, they're moving all the time. And so here's how Rebecca Dorman, she's with the private-public partnership with Invest in Children. Here's how she describes it.
Human beings have this normal fight or flight response when there's a threat. Toxic stress is when the threat is ongoing, and so the body reacts in an abnormal way, and that you're always aroused, you're hyper-aroused. We've started to understand that the brain, that kind of ongoing exposure to toxic stress is actually affecting the way the brain is being wired in damaging ways.
In case she uses the word toxic, and when we think of toxic, we think of all these terrible things that can happen with chemicals or pollution or those types of things. This is as serious as that.
Well, it's really interesting. And the word toxic is used because what some of the newer research is showing is when you're on this hypervigilant state, you're always kind of thinking what's going to happen next. And even in babies and toddlers, they're in this hypervigilant state and their bodies are releasing abnormal amounts of the stress hormone cortisol. And what the new research is showing is this cortisol actually coats the brain in ways that affect the brain chemistry and the brain architecture. And what they're finding is that kind of damage, like they're saying, what makes this toxic is because it can predispose even a baby or a toddler to what's called early childhood mental health issues like depression. I mean, babies can actually get depressed. People don't know that. And, if you intervene early and catch these things, get these kids into programs that promote stability among their caregivers, work with their parents, you can actually head off a lot of serious problems later on in the baby's life.
And we'll have a deep dive on that topic. The idea here is that the coverage will be here on 90.3, but also on WVIZ PBS. This will be a broad multimedia presentation.
Absolutely.
On the web too.
Multiple media. And like I said, we're doing the womb stuff, then we're moving into the delivery room. I'm going to have some stuff on that in terms of infant mortality, and then into the home with this toxic stress story.
And speaking of infant mortality, that's something, Sarah, that you were digging into.
Right. So when we started talking about the idea of healthy beginnings, my mind, as a lot of Clevelanders' minds will go to, is this issue of infant mortality, how we have some of the highest rates in the country and indeed in neighborhoods where we rival in Cleveland third world rates. We've talked about it here on the program before.
Sure.
This is an ongoing problem. So about a year and a half ago, I started talking to Dr. Gilson, the medical examiner here in Cuyahoga County, about what happens when kids get home. There are a lot of issues that affect this infant mortality rate, and Kay and I are sort of divvying up the story, the approach to it. So what I'm focusing on is what happens when the kids get home. If you look at the report from the coroner's office, they actually go out and investigate every case of a 12-month-old or less. And it's a whole lot of unsafe sleep habits. And this is not new news to many people in this medical community. You know, back in the 90s, the hospitals here acknowledged this problem and said they were going to work on it. Because we're approaching this from both a radio and television standpoint, I wanted to ask that question, why? And the unsafe sleep habits is something I think crosses through poverty to middle income to all stratospheres of our society. I think every mother can relate to that. And I sat down yesterday, actually, with a mother who's 27 years old who lost her baby at 30 days old while in bed. And it was something I think that a lot of people need to understand. And here's Amanda talking about her experience.
Amanda from Grafton.
I'd always start him out in his little bassinet next to my bed, but then he'd wake up in the middle of the night hungry, so I would bring him in my bed, change him, and I'd latch him on. And obviously it was fine for all those other nights, but for some reason, it wasn't fine that last night.
How many times has any of us taken a baby into bed,
Right. So I think that really, she did everything right, she believes. She was following some guidance she'd received elsewhere. And that is kind of the question I want to dig into, this idea of unsafe sleep habits and how much of those kind of unknown deaths that babies experience really need to be categorized as unsafe, and how the education behind that needs to kind of step up to modern times and kind of the conversation around that, both locally and nationally.
Well, it's going to be some emotional stuff. I'm looking forward to the coverage, and really important stuff, too. And we're going to dig in now to one specific story. This is one that you had yesterday here on 90.3. It's also been on NPR. It's on the Kaiser Health blog as well. And that's about opioid-addicted babies. There was a stat that blew me away. One baby every 25 minutes addicted to Percocet and those types of things, heroin.
Right. This was research out of Vanderbilt, I believe, University, and they had done a meta-analysis of data back from 2012 and found that rate existed in 2012. They believed it did, and if you talk to doctors here locally and nationally, by all accounts, that rate likely has been increasing since then. Here in Ohio, we've had press conferences. Just last week, we had a press conference on the air about opioid addiction, and really, I attended a press event at Metro Health about, I want to say more than a year ago now, maybe 2 years ago, where Dr. Bailett, who's going to be talking here in a minute, talked about their program and some state funding out of Governor Kasich's office that they were getting to supplement a program they were already operating. And she talked about kind of the social network that needs to be given to opioid-addicted mothers, and really opioid-dependent is the right word to use. And so when we started on this project about Healthy Beginnings, I called back Metro Health and said, hey, do you think by chance are there any mothers who might want to talk about the experience? Because what we're learning is opioid addiction is something that once you're given painkillers, as we've heard so often, there are some people whose brains are just wired to be addicted. And if that's the case with you and you find out you're pregnant, how do you cope with that? And I met an amazing mother, Amanda, who was willing to share her story about that. And this story is the result of many months of getting to know Amanda and her fiance Terrell and their baby Valencia.
Amanda is going to be joining our conversation in just a moment. But first, let's go ahead and play that piece that you put together that sort of lays out this problem of opioid addiction. When we're done with that, we're going to go to our break and then come back and have Amanda and a couple of medical professionals talking with us about that. We invite your calls at that time, too, at 216-578-0903.
5-month-old Valencia has chubby baby cheeks and clear brown eyes the size of saucers. She seems always to be cooing and smiling, especially for Mommy.
Mama. She started saying mama. So now at night when she wakes up, that's what I hear. Mama.
Mom Amanda Hensley hasn't abused opioids in 9 months. It was only earlier this year that she stopped having dreams about using. Hensley is 25 years old and began abusing prescription painkillers in her teens. She functioned for years, holding down jobs and even stopping for a bit when her now 4-year-old son came along. But by the time Hensley found out last year that she was pregnant again, she couldn't bring herself to stop. She preferred Percocet and morphine.
You know, I was sick with morning sickness, and then I was also sick from using. So it was either, I was puking from morning sickness or I was puking from being high. That's kind of how I was able to hide it for a while.
When the soon-to-be baby's father, Terrell Shepard, discovered she was using, he was worried.
If you don't care about yourself, have enough common decency to care about the baby you're carrying.
But stopping opioid use is not simple. Doctors say quitting cold turkey is dangerous for the baby, and sudden withdrawal in the mother could increase the risk of preterm labor or fetal death. At nearly 6 months pregnant, Hensley was living on couches, estranged from her son, mother, and shepherd. That's when she reached out for help. One moment she dialed to get her fix, the next she called hospitals and clinics.
Nobody wants to touch a pregnant woman with an addiction issue.
There's a reason for that, says Dr. Jennifer Baylett at Metro Health. Research finds that addicted mothers often also struggle with other psychiatric diagnoses, such as anxiety or depression.
These are difficult patients, and they're complicated, and they have complex social needs, and many practitioners are just not equipped to deal with the depth and breadth of kinds of issues that they bring with them.
After being rejected by hospitals and local clinics, Hensley was advised by a receptionist at one of the local drug treatment clinics to go into withdrawal. She did, and then went to Metro Health's emergency department. The hospital, operating a state-supported program, prescribed Subutex, an opioid therapy drug that keeps a low level of opioids in Hensley's system but doesn't bring on the highs that result in cravings. When Valencia was born, mom and baby had their own room. Nurses encouraged snuggling and breastfeeding, and they were on hand to help Hensley if Valencia's withdrawal became severe.
She wouldn't latch on. We couldn't get her to feed. I couldn't get her to stop crying. She was very fussy. And I realized, I did that to her. Like, I took her choice away. And that's one thing that I need to work through, because I still haven't forgiven myself for that.
Babies in withdrawal have a distinct high-pitched scream, and often their legs start shaking. It's very difficult to comfort them. To help babies manage, medical staff typically darken the room and administer liquid morphine with a dropper into their mouths. In the months after birth, Hensley and Valencia have moved in with Shepherd. A social worker checked in with the family for months, and Hensley completed intense outpatient therapy. She also continues to see a Metro Health doctor once a month to check how her daily Subutex prescription is working. They will adjust the levels if needed. Sarah Jane Tribble, 90.3.
Wow, we're going to talk more in depth about that particular case and the rise of opioid-dependent mothers and babies after a quick break. First, though, thank you so much, Kay Colby, for being with us. Looking forward to the coverage over the next 10 weeks.
Well, you're welcome.
Thank you. And Sarah Jane Tribble is going to stay with us as we continue our conversation. We're going to meet Amanda, now nearly a year sober, whose baby was born addicted. She's thriving now, too, and we'll learn about her struggle with addiction and also talk to a couple of medical professionals. The opioid epidemic is raging in Ohio, and it continues to take lives, and it's interfering more and more with the healthy beginning of life as infants are born addicted to these drugs, just like their mothers. Before the break, we heard the piece of reporting on that topic from IdeaStream Health reporter Sarah Jane Tribble, and she stays with us in studio to delve more deeply into this topic. Two of the voices you heard in Sarah's report are now with us for discussion, which you can join right now by calling us at 216-578-0903. Amanda Hensley is here. She's now a sober mom after she and her daughter Valencia were weaned off opioids through Metro Health's Mother and Child Dependency Program. She's here to share her story, and thank you so much for being with us.
You're welcome.
And take a deep breath, because you're rushing to get in, and I'm glad you're here and ready to discuss this topic. Appreciate you being here. Also, the director of the program at Metro Health, Dr. Jennifer Baylett, is with us. Thank you very much for being here.
Good morning, and thank you for having me.
Good morning. And joining us from a studio at University Hospitals is Dr. Michelle Walsh. She's the chief of neonatology at UH Rainbow Babies and Children's Hospital. She testified in an opioid hearing last week before Senators Brown and Portman about the resources needed to deal with dependent babies. Very good to have you with us, Doctor.
Good morning, Mike.
Good morning. Again, 216-578-0903 for you to ask questions or join our conversation. And let's start a little bit, Amanda. What an amazing story, first of all, that Sarah had put together. Talk about that idea about continuing to use drugs when you're pregnant. I wonder that there must be a strong battle within about that.
There really is. It's like, you're ashamed, with yourself that you can have to continue to use because of the withdrawal. And you're also, afraid of the way that people are going to react because you're pregnant. So, you have that fear and that shame, and it's very overwhelming.
I think we heard the quote on the piece about the idea of having the common decency to look out for the baby. And so I wonder if that's something that you would deal with or dealt with, which is sort of being judged and the idea that that you're making this choice that's not good for the baby.
Exactly. I mean, people think that, you're constantly just thinking about yourself, but I can't speak for all mothers, but I know, myself, I was constantly thinking about my child. Every time that I would get high, it would was almost useless because it would still, like, I would still be depressed and it still hurt. But like, again, I was afraid. You know, I was afraid they were going to immediately just take my child, that they weren't going to give me a chance. You know, everybody judging me when I went into the hospital. You know, it was just, I was just terrified of what was going to happen.
At some point, you made this decision that you wanted to get help, and yet it wasn't just like a phone call away.
No, I had to work very hard to find somebody that would want to take on somebody who was pregnant and addicted.
And when you say work hard, it meant picking up the phone, calling places. I mean,
many places I went into, many places I've called. They were I was either too far along or not far along enough, or, you know, they didn't have any beds available in a treatment center, until I had finally called one clinic, and they had told me what to do and how to go about it. And if I knew that lady's name, I would write her a thank you card, because essentially she saved both of our lives.
Dr. Bailey, what about that? About the idea that it isn't just, okay, I've decided I need help and I know where to get it and how to get it. It seems like there is so much to work through once you finally have made that decision.
Right. So at Metro Health, we do have a mother and child dependency program, and we really have been acting as a resource for the region. We get people coming as far away as 2 and 3 hours to come and see us because it is such a rare resource. You know, people, the folks who do drug rehab are often scared of the pregnancy and the liability and the complications with the pregnancy. People who do pregnancy aren't necessarily equipped to do the drug treatment. So having a center where those two things come together has been a really unique resource in this area. And Metro Health has really stitched together what I like to call a quilt of community resources to wrap around people. Metro Health doesn't do it all by ourselves. We have a group of providers and resources within the community that really help our patients to be the best mothers that they can be.
Our number again, 216-578-0903. You can interact in the program. I was surprised to hear, and I suppose that's the way it would happen, but you're weaning a child off of drug addiction, and there's a dropper, as Sarah reported, with morphine in it.
So one of the things that's difficult is in pregnancy, you can't just come off and go cold turkey off the medications, because that can harm the baby. It can lead to preterm birth and theoretically stillbirth. So we never want a mom to just quit cold turkey from heroin or pills, which means transferring them to methadone or Subutex. The downside of doing that, however, is still there's a 50-50 chance that the baby will be born dependent on those medications. And we do like to use the word dependent rather than addicted, because addicted has almost a willful sense to it. And it really, a baby being born dependent doesn't predict what their future will be. Those babies are at risk for addiction, because they come from families with addiction, but they are not born addicted. They're born dependent on the medication.
I appreciate that. I learned something new about the semantics today. Thank you.
Well, that's been a conversation. I think part of this story was part of a national project with several other reporters across the Northeast region for NPR too. And there were in-depth conversations about whether to use the word addicted or dependent with the mothers, because, and Dr. Bailey and Amanda can talk more about this, but once you become addicted, you're dependent really on that drug. And it's not like you can just make a decision to stop taking opioids. It's not that simple, right?
I think especially during pregnancy, it's not that simple, for sure. And we do treat babies, if babies show signs of dependency, we do treat them with what I call little tiny baby doses of morphine to help wean them off, because we want them to stay comfortable. We don't want them to have seizures or other kinds of complications.
And Dr. Walsh, what's your thought on that? I mean, I'm using the definition of addiction, and I think the definition as it is appropriate, and yet the language matters here in terms of addiction and dependence. I wonder why it is that does. Is there a stigma that still is difficult to work through as medical providers?
Oh, I think it is absolutely true. So addiction speaks more to what an adult experiences, where a craving, a need to go out and seek the drug, and that's what addiction speaks to. Whereas dependence is the physical aspects of your body being dependent on the drug. So newborns are not capable really of being addicted. They can't go out and seek the drug on their own. They can't neglect relationships. So in some ways it is semantics, but I think it gets at the more important core. And what we've been working on with Dr. Bailey and others that we're working with across the state of Ohio to address the attitudes of healthcare professionals and help them understand that being dependent on opiates is not a character flaw, but instead is a chronic illness, very similar to diabetes or other chronic illnesses, and the drug is needed to treat this chronic illness, and that healthcare professionals should put aside judgment and welcome people into treatment so they're not stigmatized.
Do we have any research on the long-term impact of this kind of addiction for babies who are born? And I'm thinking of the crack epidemic. There might be some numbers on that, but what about specifically about opioid dependence at birth?
We have very little information specifically around this opioid epidemic. However, the one piece of good news in this entire horrible story is that what we did learn from the crack epidemics of the 90s was that once we took into account the other factors in these families' lives, poverty, all of the other poor housing that they're dealing with, poor diet, once all of those other things are taken into account, there was not the horrible, harmful effect that we all feared. So we're hopeful that the same can be said for this opioid epidemic. But I think that what Dr. Baylett said about how critical it is to have the whole quilt of services to wrap around these families is really what we are learning, that it's not just good enough to treat them during pregnancy or to treat the babies for a couple of weeks after they're born, that support has to continue and is critical.
216-578-0903 is the number to call to interact with us in our conversation. Amanda Valencia is 7 months old now?
Yes, she is.
How's she doing?
She's doing great. And going back to how you were talking about the long-term effects, she actually has seen a behavioral specialist. He's kind of doing his own research thing in Metro, and she's above where she should be. She's about a month and a half ahead, which I was very worried, and my fiance was very worried. But she smiles, she plays, and she is absolutely the happiest baby I've ever seen in my whole life.
You look like a pretty happy mom about it too.
I am. That's one of the things. I've really struggled with my love for my children's and my love for opiates. It's been a constant struggle, but now I've realized my love for my children is much stronger than my love for the drugs.
And you have another child, older child.
Yes, I do.
Let's have David join our conversation with a question for our terrific panel here this morning. David in Sharon Center, welcome.
Thank you. I was just wondering, for the mother, how much emphasis do you put on getting them into a 12-step program so they can acquire long-term sobriety?
Thanks for the question. Is that part of the treatment philosophy, Dr. Baylett?
So we give the medications to help moms during pregnancy, but we also get them into a drug treatment. Sometimes that's a 12-step program. Sometimes that's a variant on a 12-step program. But we do have our moms seek intensive drug treatment. We do think that that's a critical part of recovery.
And what about in your case, Amanda? Is a 12-step program part of the treatment?
Absolutely. My home group that I go to, everybody is so supportive, be it, you're having cravings or even just home issues, everyday issues. They're there to support you and give you advice on, how not to go out and use because that's what you would have done in the past. It's almost like a second family. So I believe it is very important, and I believe it's detrimental, actually, to your recovery.
To not have it.
Yeah.
One of the things that astounded me, and Amanda's been so open because she wants to help other people understand, is this idea of how difficult it is to, even once you go through the battle of finding a place to get treatment, then you have to really stick to your guns and make sure you're following the treatment program. A lot of mothers, even if they want to, find it very difficult to get to the outpatient therapy and do it consistently. They find it difficult to make sure they're on their treatments. But then Amanda told me, and you can talk a little bit more about this, that even once she was sober, within those few months afterwards, she still had friends calling her and offering to take her to pick up drugs. Because that was the community you were with, and they were your friends, and they wanted to
Right.
share their experiences with you. And you had to say, wait, I'm pregnant. And they knew you were pregnant, but they still wanted to share that experience with you,
Right.
which is just astounding to me.
It's like they didn't care that I was pregnant. They basically just wanted to use me, and in the using community, that's all that they did that's all that they do to each other. You know, it's I'll share with you if you give me a ride, or you know, if you throw in, I'll throw in. You know, it's anything that you could possibly do to make sure that you get what you need.
Are you done with these people now?
Absolutely.
What kind of drugs are we talking about? What were you addicted to specifically?
Opiates. My favorite was like Percocet and morphine.
Did this start with an injury like it does for many people, or just started by getting high?
It started because I have fibromyalgia, and when I was younger, they didn't really know what it was, and I've been struggling with, you know, severe pain since I was about 14. And riding horses didn't exactly help because I used to show horses. And the doctor, you know, I was seeing was a family practitioner, and he was just like, you know, you're in pain. You know, I know that you're very, very active, so here, take this, and you'll be able to continue your active lifestyle and not have to worry. And, you know, I was a child. I figured if it was bad, then, you know, my mother would speak up and be like, hey, no. You know, my dad did speak up, and he was like, are you crazy? But my mom was like, no, she's okay. You know, she needs it for softball. She needs it for horseback riding. She needs it for this or that or the other. But, I mean, it's just, it started very young, you know, and that's the only thing that I wish that I could go back for myself now and be like, don't do it. Right.
And you're able to, at least with your daughter, be able to start that at such a young age too, that message.
Yeah. As soon as they're able to understand it, I plan on talking to them in a way that they can understand it, and kind of sharing a little bit of my story so they know what will happen and what can't happen. Because I plan on being very honest with my children. I don't want them to go down the path that I did.
Dr. Walsh, I wanted to work in a broader policy issue. We're hearing the very specific issue that Amanda's bringing up about how addiction took hold of her. But you spoke with Senators Brown and Portman on Friday at the Senate Homeland Security and Governmental Affairs Committee hearing. What do you think the government needs to do, or what other plans? How is that part of this quilt, perhaps, that we've been talking about?
Well, thank you, Mike. Yes, I think one measure of this is just how overwhelmed our systems are. Amanda's story about how hard it was to find a place to get treatment and that there was no bed available is symptomatic of how this epidemic has overwhelmed our already inadequate mental health and addiction services, not just in the state of Ohio, but across the whole country. And so it starts with having adequate numbers of trained individuals, both obstetricians and addiction specialists, and the post-recovery facilities that can help women and all addicts of opiates. And to put this in context, as we've been working as a collaborative across Ohio, the Ohio Perinatal Quality Collaborative, which Jen Baylett is also a leader, we're working with all of the obstetricians and newborn care providers across the state and have been for the last 18 months to improve the care of moms and babies. And in that time, 18 months in Ohio, we have enrolled over 10,000 women who are opiate exposed during their pregnancy, and we've treated almost 5,000 newborns in our hospitals in Ohio. And there simply are not the resources to do that. So a legislative effort introduced by Senator Portman and championed by Senator Brown is the Comprehensive Addiction Recovery Act, CARA, which was passed in the Senate and really quite a remarkable event with a vote of 94-1 in favor of the bill, which we all know doesn't happen anymore, right. And is now awaiting passage in the House. And that will provide resources to really help address this in every community in the U.S.
Let's have another call or two, and then we're going to wrap up this part of the program. We'll be talking with Adam Savage in just a moment with the TV show Mythbusters about the Maker movement and his push to make that, which is, by the way, taken hold really greatly in Cleveland, to make that a national concern. Gail joining us now in Lakewood about healthy beginnings and about opioid addiction. Very good to have you with us, Gail. Gail, are you there?
Hello.
Hi, you're on the air.
Hi, thank you. And Amanda, I just want to say congratulations. You fought and won a most difficult battle.
Thank you so much.
And, you know, I mean, you had to have a lot of love there. And it's so hard even to connect really when you're addicted, but you did connect. You still had that love for your family. And, you know, I deal with patients like you all the time. I'm a patient advocate.
Good for you. That's we need more of those. So thank you, and it's for doing that.
Thank you, Gail.
I wanted to talk to the doctor for a minute about the real root of the problem.
Okay, Gail, and if you could address a question, we're really running out of time for this, but go right ahead and ask the doctor your question.
Okay, I deal with a patient population with a disease called GDD, and it's excruciatingly painful. Often doctors give them opiates. That's the first thing they want to do is give you opiates. There are treatments, but the insurance companies won't pay for it. So this is a very, very vulnerable situation. I talk to mothers all the time who are on the opiates, and they're going into a downward spiral. And, you know, that's a big issue in the medical community. I would love to find an answer.
All right, let's ask that in GDD, gadolinium deposition disease. What about that, the idea of a maybe overprescription or making that a first resort? Dr. Baylett?
So I'd like to widen a bit from just GDD, but that is that, you know, how do we deal with pain in society? We see every commercial, you know, you pop a pill for this, you pop a pill for that. You have a fever, you take something. You have a ache, you take something. So I think as a society, we need to come to grips with how we deal with pain. I also think that the medical world has not helped itself. Doctors for years were rated on how well they treated pain, and to this day, our reimbursement depends on, in hospitals at least, on how we are perceived of dealing with people's pain. So to the effect that I think this is more than just a doctor issue, I think it's a societal issue. But I think there are some specific things that doctors can do and medical schools need to do to help look at alternative pain management.
And Gail, thank you very much for the call. And thank all of you for the conversation today. Sarah Tribble, very good to have you with us and bring us this story. Appreciate it. Very nice to meet you, Amanda Hensley, as well. Very good to see you.
Thank you very much.
And continued recovery for you. Someone said you won the battle, but it seems to me that the battle continues.
The battle will always continue, but I've got great support from my fiance, Terrell Shepard, and without him, I don't know where I'd be. He's my biggest support. He's my rock.
There's your shout out, Terrell.
Right.
Dr. Jennifer Baylett and Dr. Michelle Walth, both of you, thanks so much for being with us this morning. There's more from The Sound of Ideas at ideastream.org/ideasnow.